Welcome back, everyone. I am Dr. Rupa, ophthalmologist and lover of all things beauty, and today we are talking lash serums. Now, I'm not going to talk about which one works and before and afters and all of that. I'm actually going to talk about what is in these serums to make them work, and are you harming your lashes or your eyes by using them? So if you're interested at all in what you're putting on your eyelids and your lashes, keep watching. Before we get started, I'm going to ask you, please like this video, subscribe to my channel, and please comment and let me know what you are interested in seeing. I love to be able to educate, especially on eye makeup kind of health issues, because that's kind of my passion. When I'm on YouTube, I watch a lot of beauty vloggers, and I would want to know what's actually safe to do and what's not. So for today, we're talking lash serums. Everyone's obsessed with lashes, as you can tell. So am I. I've got the magnetic lashes. I try the falsies. I do lash extensions. I'm always switching it up, trying to figure out what's the best way to get my lashes to look like that. And lash serums. I've actually tried quite a number of them, and I'll give you my personal experience. But I also want to figure out what is in these lash serums that is making your lashes grow. The number one lash serum that just started this whole trend is Latisse. So Latisse started out as a glaucoma drop. Now, I remember when I was a resident in ophthalmology back in the early 2000s, and one of the main drops that we used were these class of what's called prostaglandin analogs. So they were drops like Xalatan, Lumigan, Travatan. Now there's a generic for Xalatan, which is called latanoprost. And I'm getting into all of this because what I noticed, as well as a lot of other doctors, and especially the company that made Latisse, is there were times when for a glaucoma patient, we would just start the patient on one drop in one eye because they had glaucoma in one eye. And they would come back, and especially these men, they'd have these long eyelashes on one side and nothing in the eye that we weren't treating. And so someone eventually figured out, hey, these eye drops are actually causing lash growth. And so they took the glaucoma drop, which was Lumigan, and they reformulated it into Latisse, but it's the exact same drop, to be honest. That's what it is. But they had to go through FDA approval because it has a new indication. Now, I know some of you on here don't believe in the FDA and don't trust the FDA, and that's fine, but let me at least explain what Latisse had to go through to get itself on the market as the only prescription for eyelash growth, because it does distinguish it a little bit from the other serums that we're going to talk about that you can buy at your department store, at Sephora, or online. And I think that's important. So it was a multi-center double masked, meaning both the people that were using the Latisse didn't know if they were using Latisse or just a placebo, like artificial tears. And then the people that were evaluating the photographs of the lash growth also didn't know who was using what. Did this person actually use the lash growth medicine? And they graded it on a scale to see if the lashes were growing. So that's the kind of trial that they had to go through. And then the side effects had to be reported. So when you see Latisse, you know that there are a bunch of side effects that are possible when you use it. And that's the reason they actually have to put it on the package, is because it's an FDA approved medication as opposed to just a cosmetic. It can cause redness, irritation around the skin, which is happened, I think, in about 4% of the patients. It can increase the melanin in your iris, which is what gives your eye color. So it doesn't turn light blue eyes brown, and I think that's a misconception. It actually can turn brown eyes like mine darker brown, or it can turn hazel eyes brown. So that's something that can happen. And it can actually darken the skin around your eyes. So these are all side effects that are known. You can Google them. They're on the box. They're warnings, okay? Latisse has to disclose this as a medication. So all Latisse has in it is that exact same glaucoma drop. It's bimatoprost, 0.03%. That's it. It doesn't have anything else in it. As we look at some of these other serums, you'll see that they've got a whole list of other stuff. The other serums, since they are not FDA approved, and they don't have to be because most of them won't promise to grow lashes. They will say lash conditioning, Just look at the packaging. Or they will say enhances the appearance of lashes. They will stray away from the words growing lashes so that they can be a cosmetic versus a medication. It still has side effects, and especially since many of the active ingredient is actually quite similar to the active ingredient as what's found in Latisse. So the first one, which I think is super popular and has made this company millions of dollars, Lash Boost. So before we also get started, I have tried Latisse. I had used it for a couple years, and I did think that my lashes grew, and I did not get any skin darkening, but I did get some little red bumps. I did get that irritation. It's pretty much just straight medication. There's no emollients and, extracts to soothe the medication. And I eventually stopped because when I got pregnant, I didn't want to be using a prescription medicine. I eventually went on to Lash Boost, which is one of the most popular lash serums out there. Everyone raves by that. I've seen people and their lashes are like, boom, they look amazing. But what is in Lash Boost to make it work? Have you ever looked at the ingredients? Okay, I actually need my glasses. Hold on, because this is really small. So Lash Boost has a bunch of different things. It's got water, butylene glycol, hydroxyethyl cellulose. Hydroxyethyl cellulose is just artificial tears. Keratin, which keratin is found in your hair. Hydrolyzed keratin, which is a way of treating the keratin, so supposedly it penetrates into your skin, into the hair shaft better. Sodium hyaluronate. Now, sodium hyaluronate or hyaluronic acid, both the same thing, that's what we use in fillers when we inject Restylane or Juvederm or any of those kind of fillers. That's hyaluronic acid. It's also in your joint spaces, like in your elbows, shoulders, knees. And it's also what I use when I'm doing cataract surgery. We inject hyaluronic acid. Your body just resorbs it. It's very easy, pretty benign stuff. Now remember, when they have ingredients, they're going to list it from what's the highest percentage to what's the lowest percentage. So water is number 1 and the butylene glycol is number 2. But about 7th or 8th is isopropyl cloprestanate. Now I've seen this in the other serum. That's the active ingredient. It's similar to what is in Latisse. Latisse has bimatoprost, and that is a prostaglandin analog. And a prostaglandin is basically a synthetic compound which acts like a hormone and has some growth effects on tissues. And this, I gotta put my glasses back on. The isopropyl cloprestanate is also a prostaglandin analog. So that's what's really making your lashes grow. The rest of the stuff, there's octopeptide, which is a growth factor. They've got various pumpkin seed extract, seawater, glycosaminoglycans. That's basically carbs for your lashes. Sorry, I hope I'm not boring you by literally reading out the ingredient list, but I'm trying to explain. And you're going to see that some of these things are the exact same in some of the other serums. We just don't know the percentages. There's gum, there's sodium hydroxide, there's more gum, fruit cell culture extract, that's interesting. Sweet almond fruit extract. I don't really know what these fruit extracts are doing, but okay. So it has the isopropyl cloprestanate, try saying that 3 times fast. And as I mentioned, it's a very similar kind of analog to the prostaglandin analog found in Latisse, so it is going to have similar side effects. In fact, though my lashes looked amazing, I personally did get skin darkening when I used the Lash Boost and not the Latisse. And again, this is one person's. I'm not saying that as a huge multi-center trial, but you do need to be aware. Everything that you see on the Latisse package insert can apply to Lash Boost as well. So just make sure. They just don't need to disclose it because it's not an FDA approved medication. I've got RevitaLash. That was one of the early cosmetic lash boosting serums. Let's see what's in this. Water, glycerin, which was the same thing. They had the glycerin, biotin, cellulose, gum. A lot of them have gum. Dichloro, dihydroxy, difluoroethyl prostanolamide. Organic chemistry was not my subject in college. It's like the one pre-med class I So I don't really know. Is that the same thing as the active ingredient in Lash Boost? So I texted my brother, who has a PhD in chemistry from Harvard and is super smart. And first he just told me, Google it. I was like, thanks, bro. That's awesome. That really helped a lot. Then he actually was answering some of my questions, but he did want me to add this disclaimer that nothing he says, first of all, I'm not mentioning him by name. Second, and we have different last names, so there's no way you can find out who he is. Second, that nothing he says is specific to any of these products I mentioned, because he was not looking at the chemical structure exactly. And to really find out how similar the ingredients are, you'd have to do animal studies, which I don't believe there are any animal studies when I looked up on PubMed. So with the active ingredient in the RevitaLash, it has some halogens and some other different, couple different elements which can really change the structure and the property of it, but the base might be similar. So we're going to leave it at that. It seems similar enough to me, but I'm just an ophthalmologist. I'm not a super smart chemist, but that's what he said. So it can really change the properties. So we don't really know if the RevitaLash stuff is the same as the Lash Boost. It's also got the keratin and the water and the biotin, as well hyaluronic acid that we talked about before. So a lot of similar things are in the RevitaLash in addition to the main active ingredient. All right, let's check out. So I've got the NuLash right there. They've got NuLash and NuBrow in this set. So what's in NuLash? It says polypeptides, green tea extract, blackberry extract. I guess a lot of fruit extracts. I'm not really sure what the fruit extract is doing there. Apple fruit cell cultures. Same thing as what we just read in Lash Boost. That's very interesting. Biotin. And here, isopropyl cloprestinate, which is the exact same compound that was in the Lash Boost. Now, we don't know what percentage of the active ingredient there is. Could be more in one, more in the other, not sure. But it is a prostaglandin analog, and same with the RevitaLash. Even though it is an amide and I don't know, an ester, my brother was throwing out some chemical words, ester versus an amide, but it still is a prostaglandin analog, so still you want to watch out for the same kind of side effects that are potentially possible, like with the Latisse. And then when I happened to call Sephora, the guy who answered the phone was like, oh, Grande Lash, that's the best one. So I figured I'd just look at the ingredients on that. The Sephora had closed for renovation, so I couldn't get any Grande Lash to actually physically have the product with me, but you're able to find everything online, of course. So here's Grande Lash. So the first ingredient is water, same as all of the others except for the Latisse. Then the hyaluronic acid, and the hyaluronic acid, remember, strengthens the lashes. It's that joint space fluid that just kind of, think of it like just like a really nice gel, and it brings in water. It attracts water, so it's just going to make things swell up, which is nice. That's why it's good as a filler. It's got prolines, amino acids, glycosaminoglycates, again, carbs for your lashes, everything that brings in and retains water to make your lashes look more full. And I also think that's why a lot of these other serums, by having the growth factors and the glycosaminoglycans, they do make your lashes look a lot more full than the Latisse. I think that the Latisse just has the growth serum, and the way that it works is with the growth serum, it simply is delaying that phase of anagen. That's the lash cycle phase. That's the growth phase. It makes it longer. They don't really even know how, but that's how Latisse works. But the other serums have a lot of other conditioning properties. They've got biotin and keratin. So I think that's also why when I was using the other serums, I didn't get as much irritation as I did with the Latisse, because it's not just the straight compound. The Grande Lash has the ginseng, the flower extract, same as what we saw in the other serums, similar at least, I should say. And guess what the last ingredient is for Grande Lash? Cloprestanol isopropyl. So very similar in terms of the prostaglandin analogs. That's what's really making the lashes grow longer, and all of the other stuff is conditioning your lashes and making them appear fuller. So I hope that breakdown was helpful for you. I'm certainly not recommending one product over another. I can know exactly what's in Latisse, so as ophthalmologists or doctors, it's easier to prescribe that. That is the only one that requires a prescription. However, I've seen fantastic results with many others, but you just should be aware that the same kind of side effects can happen with even over-the-counter lash serum. Even though they don't disclose that on their packaging, they still can happen. You can still get redness, irritation, skin darkening. The other huge side effect that's been noticed with the glaucoma drop medication of Latisse, the Lumigan, is orbital fat atrophy. So that's something that's not been shown with Latisse itself, but when the drop is being used as a glaucoma, like actually being put inside the eye. It's also the other reason why all of these lash serums will say not to get it in the eye, and if you have any concerns, to see your eye doctor, because these are chemicals and these can cause problems inside the eye, not only with the actual irritation of the eye, but when you are using a prostaglandin eye drop, it can cause something called macular edema, which is swelling in the retina, the back part of your eye, and it can also cause uveitis, which is inflammation inside the eye. So I always recommend, if you're putting your serum onto a brush, and I never like the lash brushes that they come with. If you search, you can find this really old video I did about 7 years ago on Latisse. It's awful, but you can see it. It's through my clinic page. So if you put in a drop of the Latisse on your nice brush, make sure you don't put too much, whether you're using any of the other ones. I know most of these are going to come with their own applicators, right? So like Lash Boost comes with its own little brush already. Don't like dip it in trying to get a bunch. Just do the one swipe, because with excess, it can drip into your eye or can get onto the bottom. Also, don't use any of these serums on your bottom lashes because of the risk of skin darkening when you do use prostaglandins. And again, it's never been reported with any of these because there are no studies, but that would be my advice, is not to use it on the bottom lashes at all. Don't use any extra. Wipe away any that's on the corner and just use the one swipe and then do the second swipe for the other. You can apply a little layer of your cream at nighttime. That's what I did, is I put a layer of my eye cream right underneath my eye just to prevent absorption, in case when I was putting on my Lash Boost or Latisse or whatever serum onto my eye, in case there was extra, I don't want it to get absorbed because I don't want any more skin darkening. Check out my video on skin darkening, because that's like the opposite of what I want. So anyway, hopefully that breakdown of lash serums was helpful for you guys. Please let me know if there are other topics that you are interested in. I'm happy to produce those. And subscribe to my channel. Follow me on Instagram. I'm all over the place. Thank you guys so much for watching. Mahalo.